For months, detectives have conducted hundreds of controlled purchases of illegal street drugs and prescription medication from area drug dealers. Many suspects will be arrested and prosecuted over the coming weeks and months. Many of these dealers are repeat offenders, and many will receive active prison terms and strict probationary sentences. First and foremost, I'd like to thank the detectives who worked so hard conducting these operations and building strong cases against these drug dealers. I'd also like to thank District Attorney Scott Thomas and Carteret County Assistant District Attorney David Spence, as well as the other ADAs in our district for the jobs they do in prosecuting these drug cases. All of these efforts make our community safer. As always, I want to thank our citizens for supporting our efforts and for providing information to us on a daily basis so that we can focus our efforts and do a better job. You are our eyes and ears in the community, and your support and participation in ridding the community of dangerous drugs and drug dealers is paramount, and we thank you. To our media partners, thank you for covering our stories and for the work you all have been doing in this area, providing information to the public about the opioid crisis and the drug issues we are facing today. Through you, we have been able to bring much more awareness about the problems we face and the solutions we seek. In this first round of Operation Spotlight, we have arrested 19 suspects and have warrants on 3 suspects who are currently incarcerated in the Division of Adult Corrections. Over the coming weeks, we will make many more arrests, and those arrests will be reported in the same manner as in past operations. As of right now, we expect to arrest 130 suspects on approximately 800 felony charges. And I've got news for you. When this operation concludes, we already have another one ready to go, with another long list of drug dealers who will be arrested and prosecuted. So, if you make it through this one, don't sit back and rest easy, because your name just might be on the next list. Now I'd like to turn it over to District Attorney Scott Thomas and then Chief Magnuson for comments that they have.
Good morning. Today we announce Operation Spotlight. This is another in a series of undercover drug operations we've conducted over the past several years. My office is proud to work with Sheriff Buck, Chief Magnuson, Chief Morris, and other law enforcement agencies in Carteret, Craven, and Pamlico counties as we try to stop drug dealing in our area. Our goal is to join together to fight illegal drug activity in our area, and this is an ongoing issue that we continue to battle that requires our ongoing time, attention, and focus. We understand that a comprehensive approach to the drug problem is required. We all support drug education, drug prevention, and drug treatment, and we believe that in the future going forward, much more needs to be done in this area. We also understand that a comprehensive approach requires tough enforcement for drug dealers and repeat offenders. These ongoing undercover operations are designed to disrupt the supply and distribution of illegal drugs and controlled substances in our region. I commend the undercover narcotics officers who spend hundreds of hours building cases that are suitable for prosecution. I'm also appreciative of the efforts of Assistant District Attorney David Spence and the time and effort he puts in to these cases and working with me to seek justice in all these cases. In these cases with Operation Spotlight, we will evaluate each case individually, and we will prosecute those cases based upon the evidence, the level of offense, and the prior record level of the person who's charged with the offense. My office will continue to work closely with law enforcement agencies in Carteret, Craven, and Pamlico counties as these cases are prosecuted in the future and in future operations. Thank you.
Good morning. First, I want to say that I have a very fond, special place in my heart for undercover narcotics work. So when I see the great work that the narcotics officers are doing, it warms me to the core. I've always thought that somewhere along the way, whether here or in Miami, some of these purveyors of poison, as I call them, these dope sellers, thought they had part of their inalienable right to sell dope anytime they want. So I think it's kind of refreshing that every time they may hear a knock on the door over the next few months, they don't know if it's going to be Papa John's or it's going to be a warrant in hand or an SRT team kicking in a door. So with that in mind, I feel good about it, as, speaking for Havelock, and then the camaraderie of the entire task force and working with professionals that you see behind me, and the professionals that you may not see because they blend in with the crowd. It's a great moment for law enforcement, great time for law enforcement, and at the end of the day, this is a war that basically it has to be unconditional surrender, or this is just going to keep getting worse and worse. So we're certainly on the right track. Thank you.
Thank you, Chief. As you've heard, in addition to strict enforcement, we all want the community to know that we also support prevention efforts in order to prevent drug use and addiction, and we support treatment efforts in order to help our fellow members of society to find a path towards sustained recovery. We must all come together to deal with these issues as a community, not just law enforcement and the justice system. We must continue to find ways to work together, all parts of our community, law enforcement and the courts, certainly, but also our departments of social services, our hospitals, our health departments, medical professionals, substance use and mental health treatment providers, and our schools. I can say that in our area, we've all come a long way in working together, but more needs to be done. Arrests and prosecutions, while a vital part, are only one part of addressing this problem. There needs to be more prevention, and we need to find more ways to make treatment available to those in need. Oftentimes, this can be as simple as providing information. More often, we have to find ways to convince a person that they need help, and then make efforts to get them to the right place where they can receive help. We need to find ways to reduce barriers, real barriers, and perceived barriers. I'd like to speak directly to those suffering from addiction. There are treatment resources available right here in our county, but they are not doing you any good if you don't take advantage of them. If you are suffering from addiction, we are asking you to seek help. If you don't know who to call, then call on us. We will help you. If you don't want to call on us, then you can go to any number of different websites and find information. You can go to carteretsheriff.com, the county health department's website, Trillium Health Resources website, and others. A simple internet search or a look in the phone book will provide you with information on local service providers. And there is no wrong door to go into. If one provider is not the fit for your circumstance due to the level of care or financial situation, they will refer you to another provider. Don't let minor or perceived barriers stand in between you and recovery. Please seek these resources. You have to try. No one can do it for you. Taking this first step just may help to save your life. There are various programs popping up all around our state. Jail diversion, diversion from prosecution, law enforcement assisted diversion, and so on. A number of counties are exploring ways to help provide more services in the area of drug treatment and linking people to services in the community. And we are exploring new programs and initiatives as well. I am hopeful that working together, we can all do more to help those who need help, those who want help, and those who are serious about their recovery. Now I'm going to speak directly to the drug dealers. We are speaking more and more these days about prevention and treatment, but let there be no misunderstanding. Our stance on enforcement has not and will not change. Strict and aggressive drug enforcement has been and will continue to be the doctrine in Carteret County and this district. If you don't want to go to jail or prison, you've got two choices. Stop selling drugs or find somewhere else to sell drugs. The choice is yours. For those who sell drugs to make money and profit on the misery of others, you are on the very top of our list. For those who sell drugs to feed your own addictions, you need to know that you are breaking the law just the same. And your addiction does not give you the right to contribute to the addiction of others. If you are selling drugs to support your own habit, we highly encourage you to do whatever it takes to seek treatment, get clean, and stop selling drugs. Again, if you want help, we will help you. However, if you continue to sell drugs, regardless of the reason, you are subject to arrest and prosecution just the same.